Let's discuss the Sun Si Miao ghost point, stomach 6, Jiache jaw bone. Location with the teeth clenched on the highest prominence of the masseter muscle, approximately 1 finger width, with middle finger anterior and superior to the angle of the jaw. How to find? Ask the patient to clench their teeth, which will allow the muscle belly of the masseter muscle to bulge. Stomach 6 is located on its prominence, a little anterior and superior to the angle of the jaw. With chewing movements of the jaw, biting and relaxing, the palpating finger will naturally fall into the right depression when the muscle is relaxed. Stomach 5 is located more medially in the depression at the anterior border of the masseter muscle. Needling insertion with the patient's mouth slightly opened, relax masseter muscle, vertically 0.3 to 0.5 tune or obliquely or transversely subcutaneously, 1 to 1.5 tune in the direction of stomach 4, stomach 5, stomach 7, for example, in cases of facial paralysis. Actions indications eliminates wind, benefits the jaw and teeth, opens the channel and luau vessels, alleviates pain. Special features, Sun Si Miao ghost point, important local point for the jaw region. Its location corresponds to a commonly used trigger point on the masseter muscle. According to some authors, stomach 6 is a meeting point with the GB channel. Stomach 6 is a major local point to expel exterior wind affecting the face. Important local point for facial paralysis combined with LI4. Humps and spasm with the masseter muscle. Local point to extinguish internal wind in the face for facial paralysis following wind stroke, combined with LI4 for problems of the lower jaw, including toothache. This is another major local point to expel exterior wind affecting the face and is nearly always used as a local point in facial paralysis combined with LI4. It is also used for mumps and spasm of the masseter muscles. It is also a local point to extinguish internal wind in the face for facial paralysis following wind stroke. It is combined with LI4 for problems of the lower jaw, including toothache. Stomach 6 is one of the 13 ghost points listed under its alternative name, ghost bed, in the supplement to the 1,000 Ducat formulas by Sun Si Miao. This grouping of points was used to treat mania and epilepsy, and it is unclear why stomach 6 was ascribed this action, especially in the light of the fact that there are no indication of this kind listed for the point. One possible explanation is the fear that epileptics might bite off their tongue while gushing their teeth during a fit, in which case stomach 6 would be included in a prescription for epilepsy in order to relax the jaw. Ghost point. This point can be effective for Bell's palsy, trigeminal neuralgia, or neuralgia of the face, used as a local point for problems in the lower jaw, teeth, face, neck, or throat. It relaxes the sinews due to yang min being rich in qi and blood. With the richness of yang min available at this point, it helps the person be fully present. The act of eating in itself is grounding, and this accounts for it being one of the 13 ghost points. Expels exterior wind affecting the face. Local point for facial paralysis, swelling, neuralgia. Local point for problems of the lower jaw, including toothache, locked jaw. For problems affecting the teeth, face, neck, and throat, sore throat, voice loss, usually combined with LI4. Local point for mumps, spasm of the masseter muscles.